Okay, I'm gonna wash my hands and gather my supplies, and I'm doing oral care for an unconscious person. So my supplies are gonna be 2 towels, a set of gloves, a cup mouthwash, oral swabs, a little bit of water to make the solution, the emesis basin, a little bit of lip balm. So I'm going to knock on the door and introduce myself. I won't wait for a response. I will come in and utilize the table barrier to cover the table to place my supplies down onto. I'm CNA Natalie. I've dropped by to go ahead and do a little oral care for you this afternoon. I'm just going to go and check the wristband to make sure. Okay, wonderful. I'm in the right room. So purposes of this video, I'm going to use this bed, but in reality, that wouldn't happen. Of course, with the table barrier down. I am going to do a couple of precautionary things first. Make sure that the bed is locked. I will raise the bed up to a good working height for myself. I'll go ahead and close the privacy curtain still. And then when I'm ready to get to work, I will go ahead and lower the side rail. I will begin by placing a towel on Mr. Bake's chest, another one on the pillow next to his head. I'm just going to organize kind of all of my materials before I start. Place the emesis basin here, here. I'm going to lower the side rail so I can more easily access, and then get my gloves on. So, as Mr. Beg is unconscious, I'm going to turn his head towards me and really get that emesis basin below him. I'm not going to do it for the video, but what I would do is open up the lips and use the tongue depressor with the gauze padded onto it to prop his mouth open in between his teeth to open it. I would take my mouthwash and water mixture and place my oral swab into it, then strain out the excess and begin to clean inside of the mouth opposite of where the tongue depressor is. Making sure to clean, of course, the roof of the mouth. I would clean the gums, clean the cheeks, clean behind the lip, in front of the teeth, those gums. Go ahead and move the tongue depressor over and do the same on the other side. And then after I've used any of these oral swabs, of course, I would throw it away. After I finish the oral care procedure, I'll remove the emesis basin as well as the towels, which I will put into our dirty linen. I am going to apply some chapstick onto Mr. Beg, and then I will remove my gloves. Dispose of them. Gather up all of my supplies. I will make sure to lower the bed back down to his care plan specifications, place the call light into his hand, raise the side rail, make sure that the bed is locked. I will go ahead and wash my hands and then note, record, and report.